The CDC tonight issuing a new warning about a deadly fungus.
They are calling it an urgent public health threat. The fungus, Candida auris, can cause severe illness for people with weakened immune systems. The CDC says cases have risen by double digits between 2019 and 2021. They add the threat to the general public is still low, but the infection could spread quickly in healthcare facilities such as nursing homes. Let's keep talking about this and some other health headlines today with Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna COVID-19 vaccine trial. So this fungus, how concerning is it?
Well, it's concerning just because the number of cases have increased so dramatically in the last year or so. The fungus itself was only found in 2009, but there's basically 3 drugs that are used to treat funguses, and this is the infections here. 10 to 15% are resistant to all 3, and about 90% are resistant to at least 1. And so, if a person gets this fungus, and if they become sick from it, almost a third of the people who contract this will die.
And who should be most concerned about this? People going to the hospital for treatment or just in nursing home facilities?
That's where it kind of is concentrated at this point, in hospitals and nursing home, long-term care facilities. This is a fungus that really sticks to everything, so it's important to really clean off all the surfaces as best you can and really practice good hand hygiene if you're in any of these areas, especially for an extended period of time.
Sounds lovely. Well, speaking of being in the hospital, and of course some choose not to be, but there is some concerning new data about the maternal death rate here in the U.S. It rose significantly again in 2021. And I think just hearing that happening here in the United States kind of just sets off some red flags. Like, that shouldn't be happening, right? So what are the contributing factors here?
Well, this was really looked at from the beginning of COVID until now. And in that time period, we've seen almost a doubling of the number of maternal deaths. Somewhere between 2019 and now, something has caused the death rate to be somewhere between 32 and 35 per 100,000 live births. Can it all be blamed on COVID? Probably not. COVID probably is a culprit. It probably does play some role in this. But really, we have to examine, are we getting health care to the women that need it? Are we giving them the best type of care that they need?
All very good points and things to absolutely focus on. Really quickly before we let you go, let's talk COVID-19 here for a moment, because new commercials have hit the airwaves. I'm sure a lot of our viewers at home have seen them. If you get COVID, get Paxlovid. Paxlovid just finally got full approval from the FDA just last week. So how can this help people? Who can benefit the most from this sort of treatment option? I think that people get confused when they see commercials and don't necessarily really know what to trust.
Right. So people who are at risk of becoming severely ill from COVID, so those with comorbidities, obesity, diabetes, lung issues, also people that live in nursing homes and long-term healthcare facilities, these are people that are at risk of really becoming sick from COVID. And so Paxlovid is a medicine that can be used within the first 5 days of diagnosis to really treat that COVID and get it out of your system. They thought that in one study that if Paxlovid uptake had been at the beginning of Omicron what it is today, probably another 5,000 lives could have been spared.
That's interesting. Dr. Bill Hartman, we always appreciate your insight. Thank you. We appreciate it.
Thank you.